Assalamu alaikum everyone. Today I'm going to talk about platelet disorders. So in this video I'm going to talk about thrombocytopenia, which is the first platelet disorder. So in this video I'm going to define the thrombocytopenia, the causes of the thrombocytopenia, the sign and symptom of the thrombocytopenia, the diagnosis and treatment of the thrombocytopenia. So the thrombocytopenia is defined as platelet count when less than 1,50,000, we will call it thrombocytopenia. The normal platelet count is 1,50,000 to 4 lakh per ml of blood. So now what are the causes of the thrombocytopenia? There are mainly two causes of the thrombocytopenia. One is the decreased production of the other is increased destruction of. So normally the platelet are produced in the bone marrow. Whenever there is any insult to the bone marrow, it will result into decreased production of the platelet along with erythrocyte and white blood cells. So the causes that are come under the decreased production of platelets, the first cause is the bone marrow failure. So the bone marrow failure is further divided into two. One is the acquired, the other is congenital. The acquired cause of the bone marrow failure is the aplastic anemia, which can cause by radiation, by tumor, by infection, and by drugs. And the other cause of bone marrow failure is the congenital, which is the Fanconi syndrome and the congenital intrauterine rubella infection. The second cause that come under the decreased production is the bone marrow invasion, in which the bone marrow is invaded either by the tumor, by the leukemia, or the fibrosis. These invasion will cause the bone marrow to destroy, and it will result into decreased production of platelets. The third point that come under the decreased production is the bone marrow injury, which can cause by the drugs. The drugs are ethanol, gold, cancer chemotherapeutic agents, the chloramphenicol, and the bone marrow may be injured by chemicals such as benzene, radiation, and infection. The second cause of the thrombocytopenia is the increased destruction, in which the platelet production is normal, but there is increased destruction of the platelets occur. But there are two other causes that come under an increased destruction. One is the immune, the other is non-immune cause. The immune causes include the infection, drug-induced. The platelet can be destroyed by infection, can be destroyed by drugs, and there is another term which is the immune thrombocytopenic purpura (ITP), which also causes the destruction of the platelets. The other is HCl. The other is heparin-induced thrombocytopenia (HIT), which is the abbreviation of heparin-induced thrombocytopenia type 2. In HIV-associated thrombocytopenia. So this is the immune cause of increased destruction of platelets. The other cause is the non-immune, which is disseminated intravascular coagulation, which results to decrease platelets. The other is thrombotic thrombocytopenic purpura (TTP) and heparin-induced thrombocytopenia (HIT) type 1. These are the non-immune cause of the increased destruction of platelets. So the other cause of the platelets thrombocytopenia is sequestration from splenomegaly. Whenever the spleen is enlarged, it causes some platelets to sequester and destroy the platelets. So the spleen may be enlarged in hemolytic anemia. It may be enlarged in liver diseases such as the cirrhosis. Other cause of the thrombocytopenia is dilutional, in which the fluid in the body become increased, which result in decreased concentration of the platelets. So these include the transfusion and the hemorrhage. So the pregnancy may cause the platelet to decrease, especially in the third trimester, but it can also be decreased in preeclampsia and eclampsia. So there is a special stage in eclampsia, which is the HELP syndrome, which is characterized by increased liver enzyme and low platelet count. So these are the various causes of the thrombocytopenia. Now, what are the sign and symptom of thrombocytopenia? Through the platelet actually clot the blood and prevent the blood from bleeding. So whenever there is decreased platelets count, it will result to bleeding. The bleeding can be occur from various sites. It can be within the skin, which is the cutaneous bleeding, such as petechiae, purpura, ecchymosis. These are the various red spot which occur as a result of cutaneous bleeding. So petechiae, purpura, ecchymosis, these are actually bleeding and each has a different size. The other is mucosal bleeding. Mucosal bleeding can be epistaxis, which is from the nose, the nose, menorrhagia, which is during menstruation. There can be increased blood bleeding during menstruation, hemoptysis, and GI bleeding and genitourinary tract bleeding. So there is also increase or excessive bleeding after minor procedure, after procedure such as surgery when platelet count is less than 50,000. And there may be intracranial hemorrhages and heavy GI bleeding when the platelet count is less than 10,000. And it can be life threatening. So now how to diagnose thrombocytopenia? Thrombocytopenia can be diagnosed by doing the CBC, which will give you the decreased platelet count. And we can also go for peripheral blood smear in which the platelet will be show decrease in number. The other is bone marrow biopsy. So now how to treat the thrombocytopenia? The first thing in the treatment of thrombocytopenia is to remove the offending agent, and we should to treat the underlying cause. And whenever there is need to platelet transfusion, we should to transfuse the platelet, but this transfusion depend on the cause and severity of thrombocytopenia. So this was all about thrombocytopenia.